because it's the truth. We broadcast 10 to 11 a.m. Monday through Saturday, and each day is dedicated to a medical specialty with an expert to offer solutions, consultations, and advice for people. My name is Moji Solar Talks, and on Radio Doctor today, we will be discussing the malady that is epilepsy. And with me is Dr. Alozie Ndubuka. Good morning, doctor.
Good morning, Moji. How are you today?
I'm very fine. What of you?
Oh, doing very well. I was crossing my fingers that you will call my name correctly.
Oh my
I
God.
think I will clap for you today. You did well.
Thank you very much, Doctor. Dr. Alozie Ndubuka is the medical director of St. Ives Family Hospital. And today is the one that justice to this particular discussion, the malady that is epilepsy. So, first, before we get into the discussion, Doctor, I would love to ask you, how was your International Women's Day like, which was on Monday?
Well, it was all right. I come from a family where women are valued. Mm. Right from my childhood, I was brought up by a father who showed high respect and care
Okay.
to my mother. Mm.
Okay.
And my father supported my mom in everything she did
Hmm.
and taught us, especially the male children, that it
Okay.
was the duty of the man to take care of the lady and
Okay.
to protect the lady in his life. Mm.
Okay.
So I've always been an advocate of women's rights, and I say that particularly being a father who has daughters.
Hmm.
So International Women's Day is a day which everybody around the world should use to celebrate women,
Okay.
and it should go beyond that day. It should go beyond that day.
Hmm.
Women folk have for long, especially in Africa, been wrongly treated. And I think it's high time we show more respect to the women folk.
Okay, thank you very much, Dr. Alozie Ndubuka. So let's get to the brass tacks of the day, the malady that is epilepsy. First, let's define it from a doctor's point of view. What is epilepsy?
Yes, Moji, this topic is quite apt in
Hmm.
the sense that Nigerians have put a lot of taboos when it comes to epilepsy,
Hmm.
and a lot of societal discrimination against both those that have epilepsy and the families of those that have epilepsy. And we are a religious people in this country, and even though I say we are religious people, we still commit a lot of atrocities. So we are religious men, but not in action. And we believe so much in so many superstitions. So much so that when someone has epilepsy, it's attributed to all manner of things.
Hmm.
So that's not the truth.
Hmm.
Medically, epilepsy is something that can affect anybody.
Hmm.
It does not respect your age. It does not respect your societal status. It does not respect your religion or your race. Both the white man and the black man can have epilepsy. Now, what is epilepsy? Epilepsy is simply a central nervous system disorder
Okay.
in which there is an unusual and abnormal electrical activity in the brain.
Hmm. Doctor, I
I use discussing
yes, the
the
reception is getting bad.
brain.
Hello, doctor.
The brain.
Yes, the reception is getting bad. I'm barely hearing you. Hello, Dr. Ndubuka. You can hear me. Hello. Hello, Dr. Ndubuka. Okay, I think we'll have to call Dr. Ndubuka back. The reception is quite bad, but Just in case you're wondering what what we are discussing today, it is the malady that is epilepsy. And Dr. Alozion Dubuka, the medical director of St. Ives Family Hospital, is the one that has been speaking to us. We'll definitely get through to him soon. It is 11 minutes past 10 and it's still Radio Doctor, your free health consultation program where real doctors advise real people. Welcome back, Doctor. The reception was quite bad the other time.
Ah,
Hello, Dr. Ndubuka.
um,
Okay, he's still very bad. We'll try reach him again. Okay, before Dr. Ndubuka, the reception started, the bad reception started. He was telling us about some myths and conceptions and misunderstandings about epilepsy in Nigeria. Because according to him, he's telling us from a doctor's point of view that epilepsy is not, because we're a religious country. People say epilepsy is might be a religious thing sometime, but he's saying that it's a normal disease, just the way we call the cancer and so on and so forth. That, and he has been trying to help us understand what exactly it is. This is the Radio Doctor, your free health consultation program where real doctors advise real people. You would definitely be able to join into the conversation on 07000 917 or you can just text or send a WhatsApp message on 070 317 56537 to speak to Dr. Alozie Ndubuka. So let me, okay. Hello, doctor. Oh, the reception is really messing us up today, but do not worry. We still have a lot of time and we'll still be able to get through to him. So, according to research, it is said that traditional medicine was was first preferred treatment option in 80.5% of participants when it comes to treating epilepsy in Nigeria. First, I love the fact that Dr. Alozie is telling us that epilepsy is not a big deal. It's not like it's a spiritual thing of somebody coming from the village to attack someone. It's just a normal disease, the same way you would view headache.
um,
Hello, sir.
okay, Moji.
Oh,
Seems
thank you very much.
seems your network is having epileptic seizures. Yeah?
And we hope this will be the end of it.
I hope so. I hope so.
Okay. Thank you very
So,
much,
so,
doctor.
so,
Please, you can continue. You were defining epilepsy for us.
oh yes, yes. I must have lost you some time ago. I said we had talked about it being a disorder
Yes.
in which there's an unusual electrical activity in the brain,
Hmm.
and this leads to abnormal movements. And I said, as a prelude to this discussion,
Mm-hmm.
it's important for us to talk a bit about the brain. Now, your brain, the human brain, controls our ability to think, to talk, to walk about, to do everything we do. The fact that you are in your studio working and coordinating this program is
Mm-hmm.
because your brain is functioning properly.
Hmm.
Now, to achieve this function, the brain cells known as neurons generate nerve impulses. And these impulses travel both within the brain and through the spinal cord to the rest of the body. Eh, And these impulses travel in a manner similar to electrical currents in your house. I talked about an example, an analogy, which is switching on your light bulb at home.
Hmm.
When you switch on your light bulb at home, you press the switch, the bulb lights up. It's not magic, it's not miracle. It's because by pressing that switch, electrical current flows from the switch to the light bulb and you
Yes.
get light.
Mm-hmm.
The same thing happens in the brain. The brain neurons, that the brain cells, generate these electrical currents and send out. And this electrical current uh, modulates our ability to move and also our behavioral abilities.
Hmm.
So these impulses for you to act well, for you to behave well, for you to go about the normal day-to-day activity,
Mm-hmm.
these nerve impulses need to be generated and transmitted in an organized manner.
Okay.
But in epilepsy,
Mm-hmm.
these impulses are not generated in an organized manner and they are not transmitted in an organized manner.
Mm.
So, in such a case, you now have a disorder in both the generation and transmission of these nerve impulses within the brain, and the individuals so involved now will develop seizures.
Okay.
Seizures. Now, I must point out, when you talk about seizures, people tend to confuse seizures with just convulsion.
Hmm.
No, it goes beyond convulsion.
Hmm.
Both your muscular, your sensory activity.
Hmm.
In seizures, the person could have convulsions, just like you see,
Okay.
and you could also have other non-convulsive seizures. There are things we call absent seizures, in which the person just stares. The person is doing nothing.
Hmm.
Just stares. Is unaware of what is going on around him.
Hmm.
So now, a seizure basically is
Mm-hmm.
a physical manifestation of an abnormal electrical activity in the brain.
Okay.
As I said earlier on, I mentioned that epilepsy can affect any age group,
Yes.
any gender, any race. But I have to state here that it is actually more common in children
Hmm.
and in older adults. There are risk factors. We'll get to that later on. But I want us, just general, I'm not going to bore the listeners with the technicalities behind epilepsy. But in general, you can actually classify this epilepsy as focal and generalized. Focal is when it usually results when this abnormal brain activity occurs in just one area of the brain,
Okay.
just one area of the brain. Right? While the generalized epilepsy involves all the areas of the brain.
Hmm.
Now, I must also point out that you have under the both focal and this, there are seizures in which there are different classifications, so many
Okay.
classifications of seizures. There are those seizures in which the person, what we call absent seizures, in which um, the person just stares, the person hardly moves.
Hmm.
You stare without blinking your eyes. You are not moving. You are unaware of what is going on around you.
Hmm.
There are seizures in which the person's muscles stiffen. And when the person's muscles stiffen, the person could fall. Such seizures are called tonic seizures. And there are
Tonic
also
seizures.
seizures, tonic, and there are
Okay.
also seizures in which the person, the muscles lose tone. That means the muscles become weak.
Hmm.
So you could have the person suddenly collapsing. Then you have other seizures in which you see the person jacking up and down, jacking up and down, what we call clonic seizures. You have also a combination of the tonic and the clonic seizures in which they are tensing of the muscle and they are jacking activity. So there are a lot of classifications when it comes to bore us with them. You might wonder what causes these seizures? Why is it that a person who probably was normal suddenly develops epileptic? What could predispose a person? What are the causes? The answer is simple. A number of things. trauma to your head when, for example, if you're involved in an accident, road traffic accident,
Okay.
or you're involved in a fight
Okay.
and something hits your head, hmm, it
Mm-hmm.
can cause bleeding within the brain, and such could irritate the brain cells, and such a person could actually end up developing seizures in the
Okay.
future. Then there are genetic influences. hmm. It's been seen that certain types of seizures hmm, tend to run more in families. hmm.
Hmm.
Certain types of seizures tend to run more in families. Hmm. So, but the extent of play when it comes to genetic influences is still being investigated by scientists. Hmm.
Okay.
Yeah, and it is suspected that it is not as extensive as it's not as extensive as the general populace fear
Hmm.
it is. Then certain brain conditions, tumors in the brain,
Okay.
strokes, cause, can also cause seizures.
Okay.
Then injuries during that's when a person is in the mother's womb, that's the prenatal period. Mm.
Mm-hmm.
Injuries in which these injuries could be as a result of an infection during pregnancy, uh, uh, or indeed any injury that deprives the baby of receiving adequate oxygen supply, lead to a situation where when that baby is born, the baby becomes more predisposed
Hmm.
towards developing epilepsy.
Hmm.
And then you have even in adults, infectious diseases like meningitis,
Okay.
viral encephalitis, and so many of these can lead to epilepsy. Now, in my earlier years in medical practice, I had cause to travel once to Jos, and I spent about 2 weeks at the University of Jos Teaching Hospital visiting colleagues of mine. And there
Okay.
was this particular case in which a patient who had been managed in that hospital for cerebrospinal meningitis
Hmm.
came back years after
Okay.
with epileptic fits. Hmm?
Hmm.
And this was because of the injury which had been inflicted on the brain by which caused the cerebrospinal meningitis.
Hmm.
So you can see the connection here.
Hmm.
Then developmental issues, disorders can also cause it seems that children who have are
Hmm.
usually at higher risk of developing epilepsy.
Okay.
So, Moji, as we go along today, we are going to learn a lot about epilepsy. We're going to talk about what are those things you can do at home to prevent fits, to prevent your getting it.
Okay.
We're also going to um, uh, talk about how to educate what
Hmm.
and what those who are friends or relatives of people who have
Hmm.
epilepsy should know.
Hmm.
So that when your friend or relative with this ailment goes into fit, what you should know, what you should do.
Hmm.
Hmm? Hmm?
Yes.
We will talk about all this. I've heard of people putting in their fingers into their mouth to stop, in an attempt to stop you without biting your tongue or
Hmm.
swallowing your tongue. Eh? And by so doing, you end up losing your finger. We'll talk
Ooh,
about
I'm already
avoiding
cringing.
such. So we'll talk about avoiding such. So,
Yes.
so that's it. Mm.
Thank you very much, Dr. Alazi Ndubuka. Wow. I keep saying it. You're a good teacher. You know how to pick
Mm.
your point and explain it. Thank you very much for that, Doctor.
Thank you very much for that also.
Like 26 minutes past 10 and see Radio Doctor, where real doctors advise real people on WFM 91.7. And it's Dr. Alazion the Booker that is teaching us about the malady that is epilepsy. And one thing that I've really picked from what Dr. Alazion the Booker, the medical director of St. Ives Family Hospital, has said that is the myths that he has been able to debunk about epilepsy. And the numbers to call is 07000 just in case you want to talk to Dr. Alazi on the book or you want to discuss something, you want to ask him anything. That's why Radio Doctor is here for you. Or you can just send a text or WhatsApp message on 070 317 56537. Okay, Doctor. You said as we get into this, we will have to discuss the prevention. Let's start from not the prevention now. Let's talk of the relatives. What relatives or people around those who have epilepsy, what they can do, the first aid treatment they can give to these people.
Okay, yes. Now, Moji, this is a very, very important part of this discussion
Okay, so
because most of the time, the first person that comes across an epileptic is probably not even the doctor. Hmm?
mm,
It's a friend, it's a relative, and it might even be someone. I've heard situations of people that while waiting for the bus or while waiting even at the airport going into fit. Hmm?
mm,
So when you see somebody fitting, somebody having an epileptic fit, what you should do as a person is carefully roll the person onto one side.
okay.
I would prefer that you roll the person more onto the left side. Hmm?
Hmm.
Let the person lie on his or her side, the left side. Hmm? Then you should try to place something soft under the person's head. Hmm?
Hmm.
You should also remove any dangerous object near the person.
Hmm.
If there's an electrical wire or something that could fall on the person and injure the person,
Hmm.
remove that dangerous object
Okay.
for the person. Then loosen the person's clothing, especially any clothing worn around the neck.
Hmm.
If it's someone wearing a tie, loosen the tie
Hmm.
because you don't want this person strangulating himself
Hmm.
with that tie. So
Okay.
loosen it. Then I mentioned earlier on, don't put your finger to the person's mouth. You don't
I
want
like
to
the way
come
you
out with
emphasize
one
that.
left finger. You don't want to come out with one left finger
Hmm.
because the person is not in control of himself. He might bite off your finger.
Hmm.
As
Okay.
a matter of fact, don't put anything. I've seen people trying to force in spoons into the mouth. Don't
Hmm.
do that. You could end up injuring the person even more.
Oh.
Don't restrain the person. I've seen people wrestling with the person. You don't do that. Don't
Hmm.
restrain the person. As long as you have removed dangerous objects from around the person, you don't need to restrain the muscular activity with the person.
Okay.
And at times like this is when you, the observer, should be calm. It's not a time to panic. It's not a time to start shouting, Jesus, Jesus, or binding and casting. No. This is not a spiritual thing. This is an ailment.
Hmm.
So hold your binding and casting and help this individual as much as you can.
Okay.
So once you can do that, hmm, hmm, the individual will calm down. And while doing all this, it will be wise for somebody to arrange for transportation for the person to a nearby hospital.
Okay.
Or if there's a doctor nearby, you invite the doctor to come and see the person. So that is the much you can do as a non-medical person
Hmm.
observing a person having a seizure.
Hmm.
Now, what are some of the things you, even you, the epileptic himself, the
Mm-hmm.
person who has epilepsy and his or her relatives, what are some of the things they can do to reduce the frequency of it or even to avoid it at all, entirely? Uh, amongst some of the things you can do include one, making sure that you get enough sleep, rest enough. A
Okay.
tired brain, a tired brain is more likely to go haywire.
Hmm.
You don't want your brain tired. Hmm? Hmm? Um, make sure you reduce your exposure to stress.
Hmm.
Don't stress out yourself. Now, certain seizures can be triggered by bright light and noise. So if
Okay.
your seizure is the type that is triggered by bright light or noise, try as much as possible not to expose yourself to very bright light or
Okay.
to a noisy environment. Then eat well, good nutrition. Eh? Take notice of having adequate water because dehydration, if you are not well hydrated, this is a very hot environment,
Yes.
Nigeria. So if you are very hot, and especially if you are the type that sweats a lot, you could easily get dehydrated, and that would push you more into having fits. Of water. Then limit that's avoid substance abuse. Let me not use the word limit. Avoid substance abuse like alcohol and cigarettes. If you can, stop entirely. That of
Hmm.
cigarette, I will even say you stop smoking if you are epileptic. Hmm?
Hmm. Okay.
Alcohol, stop if possible, but where not possible, reduce to the barest minimum.
Hmm. Okay.
Then you need to educate your friends and family about what to do if you go into fits. Once you do that, the frequency of having this epileptic fits reduce drastically.
Okay. Thank you very much, Dr. Alazion Dubuka. It is 27 minutes to 11, and the number to call is 07000 Or you can just send us a text or WhatsApp message on 07031756537. This is still Radio Doctor, where real doctors advise real people on WFM 91.7. And Dr. Alazion Dubuka has been doing justice to the malady that is called epilepsy. So, doctor, you've given us what we can do, even as an epileptic person and those who have epilepsy persons around them. Hello, good morning. What's your name and where are you calling us from?
Good morning. My name is Florence, calling from Onisan.
Okay, the doctor is here for you. Kindly go on.
Good morning, Dr. Ndubika.
Yes, good morning, Florence. How are you today?
I'm fine, thank you. Can you?
Oh, I'm doing all right. Thank you.
Okay, please go on.
The question I want to ask is, those underlying issues like hypertension, diabetes that are on drugs, are they supposed to take this vaccine of COVID?
Okay. Yes, Florence, that's a very good question. That's a very good question. I will take Florence's question on that. I think she might want to listen over the radio.
Okay, please go on, doctor.
Yes, Florence has asked a very, very intelligent question, and I congratulate her for that. Um, so now, people who are hypertensive and diabetic, she wants to know: are they supposed to take the vaccine against COVID-19?
Okay.
The short answer is yes. Now, do not. We've always been talking about what we call pre-existing
Existing
conditions.
conditions.
Yes. So COVID-19, yes, can affect everybody. Yes, but certain people are more prone to having COVID. Those who are more elderly,
Mm-hmm.
mm, like hypertension, diabetes, cancers, and all those. mm. And indeed, pregnant ladies and medical people,
Hmm.
medical people, because we see patients every day, and you do not know who you are talking to. So now, these categories of people who are more likely to get COVID should actually be amongst the first to take the vaccine.
Hmm.
If you if you look at the guidelines,
Okay.
the guidelines listed out by the government
Mm-hmm.
on this COVID-19, you will notice that among the first group of people who are listed as going to take the AstraZeneca vaccine are medical doctors, because they are frontline workers.
Okay.
Then after that, the elderly, and then pre-existing conditions.
Okay.
The politically exposed people, and that's those in government, actually should not be among the first. But the reason why they are being given, they've been made among the first, is just basically to assure the citizenry that this vaccine is all right. It's just to assure them that, oh, if the president or the governors can take, you can also take it. Hmm? If not, we live in a period where a lot of conspiracy theories abound. So if you don't see your leaders taking it, the likelihood is the conspiracy will come up and say, oh, because they know it's not safe, that's why they don't want to take it. That's
Mm.
the only reason why politically exposed individuals are taking it, just to are taking it amongst the first people. If not,
Mm.
they shouldn't be. So, to Florence's question, if you have hypertension, if you have diabetes, if you have any other serious chronic ailment, which puts you in that category of people called those with pre-existing condition, yes, you should take the vaccine. So, Florence, please, if you have this, please register to take it. And when it's your turn, please submit yourself for the vaccination.
Okay, thank you very much, Doctor. It is night. Let me say not 21 minutes to 11, and it's still Radio Doctor, where real doctors advise real people. The number to call is 07009179117, or you can just text and send us a WhatsApp message on 07031756537 to talk to Dr. Alozio Ndubuka. So we've been talking about the malady called epilepsy. And doctor, I really want you to talk about the prevention now. You mentioned it earlier that it can be prevented. So let us know the prevention, sir.
Yeah, yes, we talked basically about some of the things you can do at home.
Mm-hmm.
And to try to limit your getting it. And in talking generally about how to prevent, we have to look at the risk factors. The risk factors basically are what are those things that increases your risk of developing epilepsy. Hmm? Eh, So there are some that you can modify, and in such by modifying it, you can prevent the the ailment. But there are others you can't modify. Risk factors like age, hmm, you can't really modify it. As I said earlier on, it's more common in children and in older adults. So children, you have to pass through childhood. You cannot jump passing through childhood. Hmm? Uh, but other risk factors like injuries to the head, you can prevent injuries to the head by being more careful when you're driving. When you're driving, put on your seatbelt. Don't overspeed. Obey traffic laws. Those are very simple laws. And by so obeying traffic laws and putting on your seatbelt, you reduce the chances of an accident and therefore you reduce chances of having trauma to the head, and of exposing yourself to this risk of developing epilepsy. If you are on a motorbike, put on your helmet. I drive around every day and I see our so-called Okada, our motorbike. Most of the riders, most, if not all, hardly wear their helmets. I think government has battled with them over this, and government itself has gotten tired and has left everyone to himself. And their passengers also refuse to wear helmets. So you put on these helmets to protect your head from injury. We talked about vascular problems.
Yes, we did.
Problems within the brain, problems within the brain causing epilepsy. And one of the most common things that can predispose you to developing epilepsy is stroke. Stroke. So if you have anything that predisposes you to stroke, things like high blood pressure, diabetes, you should try and control them.
Okay.
If you have anything that can damage your brain cells, that's if you're doing anything that can damage your brain cells, like taking alcohol, substance abuse, alcohol, cigarettes, you avoid them. So that reduces your chances of developing epilepsy.
Okay.
Then feed well. Observe adequate hygiene. Adequate hygiene protects you from getting infections, from getting brain infections, which will now alter your brain cells, and therefore thereby leave you with a life of epilepsy.
Okay.
So once you do that, you will be all right. Remember, a body that is well taken care of takes care of you.
I like that. A body that is well taken care of takes care of you.
And that's the truth. That's the gospel truth.
Thank you very much, Dr. Alazion Dubuka. Wow, you've done so much justice to this epilepsy topic. And now I really want to know, you've given us the preventions, what we can do to prevent it at the end of the day, and the precautions we can put into action as someone who has it, and also for the people who surround themselves with, who have, how will I say it? Okay, yes, as for people who have epilepsy, what they can do and not do to help them before they get to the doctor. So now, is there a treatment? Is the epilepsy itself, does it have a treatment, how it can be treated and possibly eradicated from someone's body once someone has it?
Now, Moji, epilepsy, when a person has been diagnosed with epilepsy, you've met your doctor. The doctor, first and foremost, there are certain things the doctor has to establish.
Okay.
Having interviewed you and your relatives, and having performed a neurological examination and running some tests, blood tests to check for infections and genetic conditions and all those, and other tests like EEG, electroencephalography, CT scan to check for tumor or bleedings, and MRI. Be able to, first and foremost, classify, is it generalized?
Okay.
Which area does it affect? How does it come on? What is the uniqueness of your own epilepsy that's different from another person's epilepsy? Having established all these facts, there are many treatment options. The doctor could choose to use drugs, medications to treat you.
Okay.
There are so many classes of drugs used in managing epilepsy. The doctor could use any one of them. The doctor could, in severe cases, recommend surgery to
Okay.
treat a case. Now, I would like to touch briefly on drugs. Now, without naming any of the drugs, because it's not proper to call the names of these drugs. I don't want my patients going to self-medicate because they heard me mention names. Without naming them, most drugs used to treat seizures, most of them, and this is something a doctor must explain to every patient, most of them have some side effects. And these side effects could include things like dizziness, being fatigue, being tired, weight gain, speech problems, loss of concentration and coordination, and initial issues in remembering things, memory problems. And in some cases, there have been cases of people reporting, oh, this drug is making me feel depressed and cool. So those drugs, when a doctor starts you on a drug for your epilepsy, one of the first things he's going to do is he's going to what we call titrate your treatment. Most times he will start you on a low level, low dose, and gradually increase it while watching out for these side effects. He will do this using, he might occasionally need to withdraw a particular drug and give you another type. He does this to find the right drug for you and the right dose for you. The dose which person A takes to find to have some relief is not the dose which person B might require. So this is why it's very important to work with your doctor when receiving treatment for epilepsy, and not just to go into a pharmacy and buy drugs by yourself. Then in some cases, when drugs fail to provide adequate control over seizures, surgery may be required. In with epilepsy, surgery for epilepsy, what the surgeon usually will do, will remove the area of your brain that is causing these seizures. Before doing this, the surgeon has to be sure that this area of brain does not control vital functions like breathing, speech, language, and ability to move. If these are areas that control your ability to move, then surgeon will not remove it because he does not want, while trying to solve one problem, cause you to be paralyzed. No. So he will only remove those areas that are not affecting vital functions, for which are causing abnormal firing of neural stimulus, and therefore causing epilepsy.
Thank you very much, Doctor. Hello, good morning. What's your name and where are you calling us from?
Thank you.
Okay, can you move away from your radio so I won't have a bad reception here? Okay.
Are you hearing me now?
Yes, loud and clear. What's your name?
Beautiful. My name is Mrs. TJ.
You're calling us from?
From Ibafo.
Okay, please go on. Dr. Alazie is here for you.
Doctor, good morning.
Good morning, Mrs. TJ. How are you?
Thank you very much. Our able teacher and professor.
Thank you
so much. Thank you, sir. How's your family, sir?
Oh, they're doing very well. Thank you.
Okay.
I'm fine.
You didn't ask of my own family, but no problem. I'm not annoyed. So just go on with your question.
Sorry, I've not mastered your name.
No problem. Just go on.
You are new in our radio station. Thank you.
Yes.
So, my question, you have been talking about epilepsy. What is the difference? Is there any connection between epilepsy and stroke? Because I had a friend who did not have epilepsy before. It was when he got stroke, epilepsy entered, and it was really bad. So I want to understand, the connection between epilepsy and a stroke patient, and the family members, what they can do.
Okay.
Yes, thank you very much.
Okay. Thank you, ma. Kindly listen over your radio.
Okay, yes. I'm happy Mrs. TJ brought up this question. If you remember, while I was discussing causes of epilepsy, I mentioned brain conditions, certain brain conditions like tumor of the brain and indeed stroke. Tumor of the brain disturbs brain cells, and when the brain cells are disturbed, they fire nerve impulses abnormally. They generate abnormal currents.
Okay.
In the case of stroke happens with the blood supply to the brain. You have two major types of stroke. There's that one which cuts off blood supply to certain cells, and there's also that one which causes bleeding. So in both types, obviously, supply of blood to cells of the brain becomes compromised. And when cells of the brain lack adequate supply of blood, that means these cells, you are denying them of nutrients.
Okay.
Because blood carries nutrients to various cells.
Okay.
These cells, you are denying them of oxygen because blood carries oxygen to the cells. And these cells also, you are denying them of disposing of waste products generated in their own metabolism. And there will be accumulation of this waste in the cells. Now, all these reduced nutrients, reduced oxygen, accumulated waste in the cells will affect the function of that neural cell. And affecting the function of that neuron means that the electrical activity of the neuron will be affected. And therefore, there will be a disorder in the firing of the impulses of the nerve cells.
Okay.
So that's how epilepsy comes. So it's not surprising that Mrs. TJ's friend who had stroke, after recovering from the stroke, now developing this malady called epilepsy. It's not surprising because the cells have been so affected that they are now firing abnormally.
Okay. Thank you very much, Doctor. Okay, so let me get your final words. Time is so fast spent, and I'm like, can we just continue?
Yes. I would like to everyone out there to know that epilepsy is something that can affect anybody.
Okay.
We should be mindful of how we treat those who have epilepsy around us because tomorrow it could be you. Like the example which Mrs. TJ gave now, is a friend who never had it before but had stroke and now has it. So we should be mindful of how we treat people.
Okay.
It is not a curse. Those who tell you, oh, you have generational curses, that is what is causing it. It is not a curse. It is not a spiritual attack. Nobody from your village is attacking you. It is not because you are not in one particular church or one particular mosque. No pastor or imam should be laying their hands on you to cure you. If you have this problem, go to the hospital. The doctors will treat you. For those around them, please, anytime you see someone in a fit, just secure the person, remove dangerous objects from around the person. Make sure that the person is comfortable by placing a soft pillow, if possible, underneath the head of this person. Using any tight clothing the person has, and support the person during that period of convulsion. At the end of it all, make sure that the person goes to the hospital to see his or her doctor. I hope that identify, at least to some extent, this malady called epilepsy.
I'm sure you have, Dr. Alozie Ndubuka. Thank you very much for your time. Do have a great day.
Moji. Thank you. You also have a lovely day.
Thank you. That was Dr. Alozie Ndubuka. You can reach him on 080 330 32523. Just in case you have more questions for him on 080 330 32523. Dr. Alozie Ndubuka is the medical director of St. Ives Family Hospital, and today we were able to discuss on the malady that is epilepsy. He was able to demystify so many myths around it and told us what we as humans, as fellow humans, can do for anyone who has epilepsy. By any time you see someone have a seizure, you can definitely roll the person on the left side, place something soft on the person's head, remove dangerous items from around them, loosen the person's clothing, and he mentioned especially the person's neck so the person won't strangle his or herself. And he also said if you have epilepsy, it is not from the village. You just have to just know that it can happen to anybody. He said for you to prevent it, you can make sure you have enough sleep, because when your brain is tired, it can cause so much. Have good nutrition, particularly adequate water that do not dehydrate yourself. And he also said we should avoid substance abuse. Those who have it should avoid substance abuse. Do not take anything too much. He mentioned cigarettes, alcohol, and so on. And he said, educate your family and friends about it. So just in case you have it, tell your family and friends what they should do and not do, just in case you have your seizures, because it is not a big deal. It can happen to anybody, just like any other illness. And finally, he told us about the treatment of how to get it out of when you go to your doctor, that treatment is determined by each person. You can't give what you give to Mr. A to Mr. B, because it's on different persons, and that is how it can be treated. And I love what Dr. Alozie Ndubuka said. He said, a body you take care of takes care of you. And this is where I will get to say bye-bye. That do have a healthy day. This is the Radio Doctor. We broadcast from 10 to 11 a.m. from Monday through Saturdays on WFM 91.7. And tomorrow it will be another time with another doctor. Definitely a big thank you to my in person of Esther Laribe. I'll see you next time. My name is Mojisola Talks.
To sponsor this program, please call 080-9058-2769.
My better people better don land o. Ives Medicare HMO na one of that ogbonge health maintenance organization wey our government stamp gidigba for health insurance matter. My country people, why you go sick before you cover yourself? What if money no dey when you fall sick? Ives Medicare HMO get better health plan and benefit for organized private sector, schools, communities, and even private individuals and families. Ives Premium for all their plans dey pocket friendly. Na shikini money. Ives Hospital Network na all over Naija. Dem fit help you arrange treatment for obodo oyinbo. Their head office na number 2 Osho Street, Okpebi Link Bridge off Okpebi Road, Ikeja, Lagos. For more information, call 080-93-555-863 or 080.
Northern Nigeria